June 5th, 2018, and it's our work session. And what we'll do is start with a department update with Silas, and Lindsay is here as well. So why don't you guys join us at the table, and then we can talk about some of the agenda items if anybody has questions. Thank you for being here.
Great. Yeah, good afternoon. It's nice to bring Lindsay to department updates. That it makes sense to have her here. She's able to. Yeah. I don't know if she'll make everyone, but I think it's a good opportunity to get her voice here to the table and help me with updates and questions.
Excellent.
Welcome.
Thank you.
I have 5 things, some of which we'll do together, and also a warning, which I'll save until the very end.
Well, that's setting us up just right, aren't you?
If you're curious,
So that's
it.
6 things.
It is, but it's like my hidden 6.
Didn't we start with 3?
Yeah. Well, the change from monthly to quarterly has led to we're doing a lot of business. You should
Already
hear about.
lost
So
control.
we'll keep it brief. I have 5 things.
Already lost control.
Okay.
Yeah.
All right.
First things
This is
first.
Silas's time. Silas, take it away.
Here's a packet. This should help. Inside your packet, 3 of the things I'd like to talk with you about are included. The first one is this morning I did some public testimony at the Oregon Health Policy Board, and I just wanted the Board of Commissioners here to be grounded in we are going through a pretty important policy process with the Oregon Health Authority. They are governed from a policy framework by the Oregon Health Policy Board, which is an independent group that is more than just advisory to the Oregon Health Authority. And I think in some ways it's a really good reminder that the OHA doesn't work completely independently. And so when we have opportunities for policy input and opportunities to give feedback to that body, I think it is wise. This was related to CCO 2.0, which is coming soon, because in the calendar year 19 period, there'll be a recertification process for all CCOs, which at worst would be opening up the entire book of business for outside competitive bids and big, for-profit corporations from out of state. And at best will be, maybe revisions and tweaks that really make sense for local communities. But now's the time to get the Health Policy Board thinking about how they want to help the Health Authority guide those decisions. So locally, our CCO will have to do recertification in 19 with new contracts starting January 1, 2020. So we're a ways away, but it's good for y'all to be remembering that work. And I have a feeling maybe at fall AOC or some of your Association of Oregon County meetings, there'll be more topics related to this. I won't go through my testimony, but if you look at the 5 things that are related to CCO 2.0, and then the 5 things that are listed in there that are related to the broader population of behavioral health system needs, they're things that the counties across Oregon have agreed are really fundamental. So my testimony was as president of the Association of Oregon Community Mental Health Programs, really representing the local mental health authorities, the boards, but our community mental health programs, some of which are not-for-profits and some of which are county-based. That's a singular voice that we use to do advocacy and testimony. That's the first item. Unless you have other questions, I'll just move to the next one. Please do check out if you have time, check out the letter. It is 2 pages, sorry. And thank you, Laura. Laura gave me a little bit of input around it last week too. And I would have had more input from you, commissioners, there, but you were unavailable, so I went forward.
But I did read what you
Yeah.
had suggested in the
Good,
final
and
minute.
I forwarded it to you yesterday.
Yeah, thank you.
Yeah. We just thought it'd be a good time, Lindsay and I both, to do a brief update on our Certified Community Behavioral Health Center project. We're a year in. As you recall, we did this as part of 8 states in the nation and 12. Are we at 12 sites now?
11.
It went down to 11.
Yeah.
11 within the state of Oregon. So we are in a small cohort within a small cohort of states doing this important work. It's really the backbone of the model, which is federally funded, completely federally funded at this point, as a demonstration for 2 years, is integrated health within a behavioral health home model. So different than what you hear about when we talk about primary care having a patient-centered primary care home. This is more of a behavioral health home with primary care, in this case with Virginia Garcia working collaboratively with us. But we've been able to do a host of things that is additive to what we were existing, what was existing. We've added capacity, we've increased service, In the second part of your packet, you can actually read along if you want. I don't need to read it out loud. But some of the summary in terms of service increase that we're starting to see is called out. Visually, you can see it, but if you just read the little text, I made some simple marks at the bottom where you can see average clients seen per month increasing at almost 14%, and visits per month increasing at almost 18%, and also new cases, new enrollments increasing by 30%, 32%, pre and post. So we're seeing community need that we knew was undermet and unmet, and we're now being able, with these additional federal funds, to increase the service array and the quality at the same time that we are seeing more, creating more access. And on the back, you'll get sort of an idea, and I'd love, Lindsay, if you want to add some here. Some of the clinical measures that were already in our model, either we were doing, but we weren't being able to capture the data in the same way. So a lot of this is around data capture, but you'll start to see our quarterly data capture in some places increasing significantly, in a few places looking at the metric. And the one place that went down significantly, the depression screening, it was how the state was actually defining the tool. The measure got redefined, so that's, explainable by a state policy decision. But maybe you want to just talk about some of the stuff either our teams are doing or observations you've seen.
So we've been able to do a lot of nice things in addition to what was already in place before we began the certification process. So a lot of clinics were really starting from ground zero and trying to figure out how they were going to partner with primary care and do those types of things. And since we already had them located, we were really poised to think sort of the next level of, well, how do we just provide care together more frequently, just more collaboration and coordination. And so that's been really nice to be able to partner with Virginia Garcia in a more in-depth way. The other things that we've been doing are thinking about some of these risk factors that we are now identifying through this process. The BMI, those are out of range, as well as tobacco, and then partnering with outside organizations to help bring additional services and programming into the building. So partnering with the Cancer Foundation for tobacco cessation classes, which we didn't have on site before. Partnering with the CCO and their Community Health Worker Hub to provide the diabetes prevention program, both models which are evidence-based and show some pretty dramatic improvement in terms of overall health. And I think, just back to the bigger picture, I think what's so nice about thinking about these behavioral health homes is we know that individuals who have mental health challenges die an average of 25 years before the general population. So how do we work together to figure out how we can change that? And I think it takes physical and behavioral health working together to do that. And this really helps us set us up to be able to do that effectively.
On the suicide risk assessments, is that across all the population, or is it focused on seniors, focused on veterans? Those are two of the areas that have the highest incidence.
Yes.
Just curious.
So the numbers here are reflected anyone in our service array. So that would be, we've got it separated by youth. So that would be whatever age up until about 18. We don't have this broken down by subpopulations outside of adults. Although it's a great question, and I know that Veterans has worked to do some things to support that population in different ways with peers and things like that, because it is a population that has a lot of added.
Yeah, I was on that workshop in Pendleton here a couple weeks ago, and they really had a strong emphasis, in fact, one whole session on suicide among seniors and how it's a growing situation, because especially in rural area, which is what it was focused on, because they're so cut off. And so just wondering how we were engaged in that.
Yep, and we definitely have experts within our teams that are looking. Our senior behavioral health specialists, we have a single person identified to lead that work. And folks with specialized training in veteran services as a subpopulation. So we've been sending people to the National Guard has these STAR behavioral health trainings, so we've been sending additional staff to learn those skills. This particular suicide risk assessment, we've been doing suicide risk assessment for years and years and years. What you see is our data capture to report back in this metric. It's not that we weren't doing it before.
Yeah.
We are doing it now. And there's some other opportunities for targeted subpopulations. Obviously, seniors who are isolated and homebound, and veterans, because often there's access to firearms, and that's a lethal means that often people are successful. But so there's some extra risk factors around that population.
And one of the requirements to be a certified clinic is that we have to provide some level of training on working with veterans to our entire body of staff. So we have that, and then we have additional training like the STAR training Silas mentioned, which is more in-depth and specific training.
Knowing that your client count has increased over the last year, how much of the increase in the metrics is also reflected due to the client, numbers of clients being increased?
These are more the percent of the population that's receiving. So it's not, there's not a correlation on this measure
Not
to
on
the
this
numbers
one.
of enrolled new cases.
Okay.
We are adding staff, of course, under the total capacity expansion
But
to
these-
meet the new cases, the new
But
enrollees.
these increases don't reflect an increase in clients.
Correct.
Right.
Yeah. It's more of an increase in the data capture capability. And where we want to get to, which we're not at today, is leading our decision-making around the outcomes we're seeing or lack thereof. So in a true future for healthcare performance, including behavioral health, that the CCO and health policy people at the rest of the agenda today after my testimony, for example, this morning, is around value-based purchasing. And if we can show our value in reducing harm or other downstream health impacts like diabetes or hypertension or any number of things linked to chronic disease management, in a behavioral health setting, if we can show our value, we are going to not only help people be healthier, but we're going to help payers understand that there's a value proposition and making the investments into health promotion, prevention, early intervention, and targeted intervention. Just like we know if we can do good prenatal care and really good early intervention and identification, we can keep kids ready to learn in kindergarten and on track with third grade benchmark for literacy, that we are going to have a kid that's much less likely to be in juvenile delinquency or drop out of school or become a drain on other public system cost and resource. So it's that same story told in more of a behavioral health targeted clinical setting, and we want to show our value. But right now it's getting the data capture and understanding baseline and being able to meet the deliverables for the award of the grant, sort of where we're at.
I have a question, As I go back to the new cases per month chart,
Mhm.
is this something that is normally cyclical? Because if I look at these prior, it seems like the winter months are normally
Yeah.
kind of down as far as the number of clients, and it peaks towards the summer and then it drops towards the winter. So is this something cyclical? If we went out 3 years from now, we expect to see that those same peaks in the summer and declines in the fall, or the
Yeah.
winter.
So there are what we call seasonality or seasonal trends within subpopulations, and I can give a couple examples. However, no, I don't think this is linked to that
Okay,
directly.
it's not linked.
This is too broad of a population. But for example, in family youth and in serving youth and family populations, we know the cycles really clearly when things happen, and it's predictable. A couple weeks after school starts, we see referrals coming in. It's when families first start to have challenges or behaviors are identified again in school, and school counselors are needing help. And then it ramps up steadily, and then over the winter holiday, people will cancel appointments and we'll see a drop. And then right around holidays, New Year's and Christmas, there's family conflict and challenges happen again, or we'll have people access crisis services. And then we see a steady increase, and then summer falls off. And so now we do some things to do targeted outreach in the summer, some of our summer blast programs, some of the things we do with in-home supports around those holiday time periods. For example, that's one subpopulation, but we have a few others.
And that was my question, based on the cyclical, how do you handle this with programs to work with those cyclical areas?
Outside of our school base, where we redeploy people who are really embedded in the schools in the summer, we redeploy or bring them back in the clinic, and it's a little more of a tag team and some coverage, but also outreach, and do a lot more home and community-based activity skills training. Outside of that subpopulation, we're busy year-round with the rest of our populations. And even though there's a little bit, we don't have to do things to actually redeploy.
So a lot
That's
of
the
those
one.
drops we're seeing, those cyclicals, are basically based on mostly that one subgroup.
I think so, yeah.
Okay.
I would say it's
That answers
in there.
That answers my question.
Are you seeing any significant changes in working with the Oregon Health Authority since they've been doing a lot of internal reorganization? And does it look like they're becoming easier to work with or have a better handle on their jobs?
I would say it's too early to tell under Pat Allen, the new OHA director. I know that he is handling external relations much more strategically, and I think being more careful about having actuaries and outside entities come in and check some of the detail around the previous accounting and financial decision-making process. So I think there is a level of accountability that he's trying to build into the systems. But I would say it's focused there and on how does he handle the apparatus, like the legislature and the politics side of the business, and maybe starting to rebuild some of his cabinet or executive leadership. I don't see any behavioral changes within the rank and file or the mid-managers or the culture of the organization yet, although I can see that there could be some someday. It's pretty early.
He spoke to AOC, and it sounded like he had a really defined objective. So I'm just curious if you've seen anything like that. Good. All right.
Do you have anything else on that? So CHA and CHIP, which is the Community Health Assessment and Community Health Improvement Plan, the third thing in your packet, we wanted to bring to you sort of a high-level summary of the community health assessment, which we love getting input around, like how does this read, what do you think is, this should be something that's can be read by a broad cross-section of community, and we're open for feedback and input. You might, if you have a lot of it, you might think about sending me an email afterwards. Very open to that process. But I thought maybe, Lindsay, you could just give sort of an update on where we're at with next steps with the Community Health Improvement Plan, which is our next big piece of work around this.
So for 3 of our priority areas, which are behavioral health with a focus on alcohol and substance use disorder and suicide prevention, and then trauma and community resiliency and preconception health, we are in the process, and the process looks a little bit different as far as where we're at with each of those, but developing community-based work groups. So we have individuals that are largely partner organizations like Lutheran Community Services, the CCO, but also schools, and there's one community member that is on some of them and is really just representing herself as a parent, which is fabulous. And those groups are really charged with helping us figure out what are the activities that we want to be doing to help support this work in the community. What are the gaps that we're seeing, and are there ways that we can fill those? Sometimes it's we as in HHS finds a way to fill that need, and other times it's partnering with someone else around the table, and someone like Lutheran or the CCO saying we'll take that on, and that seems like something that would be great, and we just sort of help track those things. And so our behavioral health and our trauma and community resiliency work groups have already had one initial meeting. We're getting ready to have the preconception health meeting, which I'm really looking forward to. And our focus is on that one is really around how we can work with community providers that provide prenatal care and just overall primary care, and how they interact with individuals to help really make sure that they have conversations with family members around how they can be at their healthiest before they get pregnant. We know there's a lot of things around tobacco cessation, around healthy eating, sleeping, all of these things that we know are really foundational to those pieces. How can we help get more of that infused into sort of the clinical service array? And then the tobacco really is focused on, we don't have a work group for that one. We decided that one felt more like it would be wise to keep internal, and what we're doing there is really thinking about how do we prevent youth from using tobacco? How do we stop kids from starting to use tobacco, and how do we increase awareness of cessation resources in the community? What can we do? We don't provide direct cessation resources, but we know places like the Cancer Foundation does, so how do we do that? As well as bringing them into our own service array where that makes sense, like at behavioral health.
And just a reminder on process too, the CHA and the CHIP, as we call them, are required activities for a health department like ours, any local health department. And then also because we're nationally accredited now, it's like a double requirement, as if it wasn't just a single requirement. But interestingly, Providence Newburgh, as a nonprofit hospital, and the CCO locally have to do a community health assessment, health improvement plan as well. In years past, we've been as far as the first year of the CCO, we were actually contracted, Public Health was contracted to help do that work, and they've built some resources, but we're still connecting. So a lot of what we do is find synergy where there's existing work happening, whether that's in a school setting or a medical community or in the hospital care, and then look at opportunities to make sure that we're strengthening and reinforcing and in some cases doing new activities as well.
We had a pretty robust community process even after we did the community health assessment, which also included community input to help really narrow down, because as you can imagine at the community health assessment level, there was all sorts of important needs identified, and then we had to really pare that down to say, well, what feels like is the biggest need, you know, what is the community seeing and perceiving as the biggest need, and then what do we actually have a resource to be able to manage, and through those different lenses, this is
If you'd like, we can send you the full report, which is not 4 pages.
assessment.
The full assessment,
What's that?
which has a lot of really interesting statistics, and it's all benchmarked against Oregon norm, so you can go back and forth and see what we're doing better or worse.
Yeah, this, I was very impressed when I looked at this, very good publication, very simple, very easy to understand, has the facts. How do we get this out to the community so citizens are aware that this, like this doc meeting exists?
I would love to hear your ideas and suggestions on that. I think we, promote it in the small ways that we can by, providing it to different partner organizations and things like that. But
Available for download from the HHS website.
It is on the website.
I'd like to see the full report.
Great, we'll just send it to all of you.
Yeah.
Okay, that'd be great.
That's an action, yeah. Any other questions on this, or?
I would just say tobacco deaths for years have contributed 25% of the deaths in the state. Statistically, I was interested in these percentages because overall statewide, the last number I heard was 18% smokers. Is pretty much average, which is a significant reduction from a few years back. It has gone down considerably, but it's held at about 18% for about the last 6-8 years. So, and it is it's one of the real big health issues.
And somewhat related, but definitely with some different context and process we need to think about is marijuana. So just a little bit of a teaser that I am working in some marijuana policy prevention kind of options for you all to look at with us, and we'll be back to talk about that another time.
Cancel it. Bernal Fields.
And then
And
everybody's.
if you have creative brainstorms, send them my way. I'll probably cross out the ones that just don't
We
seem
do the same
doable.
thing with
but,
the
you know.
tobacco. People in the South would like it. We keep talking about what a significant health issue it is, and then we keep producing it because anyway.
That is a good point, it's been legalized, it's legal, but I don't think a lot of people really look at down the road the additional issues and problems it causes to really know what it's really done and what it's going to do to our health care. So
It's
it's
going
short
to
of burning
produce
it
more
down.
money to work with those issues it's going to create, right?
Well, another catch-22, to produce more money so we can spend more.
All right, so let's move along. Anything else? Any other, did you have you had another?
I have a
item?
4, a 5, and a warning. So
Okay.
4 is a congratulations, and I have said publicly previously that we received an award for our supportive employment and education program. And last month, towards the end of May, we sent Sue Brandt, who is our longest continuously employed support employment specialist, to Tennessee to receive this award at the annual meeting for the International individual placement and support learning community. So that's what we call this program. It's IPS model. It's a fidelity-based, evidence-based practice where we help people with mental health and substance abuse challenges gain competitive employment and build the skills all through prep and helping them gain skills and job training and working with vocational rehabilitation, and then finding and getting the jobs and following and supporting and helping employers really understand how to work in a supportive manner with them. So we now have, since 1987 when we started, we've been adding little bits. In 2008, we had 2 supportive employment specialists, which at the time was quite a number. We now have 8 today, one of whom is targeted just for supportive education, one of whom is really focused on primary substance abuse issues, the other 6 being more traditionally in the supportive employment mental health folks. We incorporate this into our first episode psychosis program for our ESA, the Early Assessment Support Alliance. So for people who are having challenges and they're young and they don't necessarily want to have a life of system dependency and having a mental illness and the stigma, usually they want, a girlfriend, a boyfriend, a car, and a job like any young person that's out there in the world, right? So we help them and their families pursue those goals as well. So it was nice to be able to send Sue and not send a manager to the conference to receive the award, and she did give a little speech or, have to say a few things. And we're very proud of that. So I wanted to take time to acknowledge her, but really as a representative of good teamwork and Emily and Community Support Services.
Silas, do you have any statistics that show the success of the
Yes.
support employment?
Yep, all kinds of them. And partly our award was built because the fidelity model measures our successes in terms of competitive job placements and percent that are currently employed, and we've been tracking really well. And so I'll put together something and send it to you. I don't
Or
have
just-
it right here.
You don't have
Emily she loves the data, and actually as part of the fidelity model, they like to know that the policy team, the Board of Commissioners, sees that regularly. And that's why, I do send that stuff every now and then. You sometimes
That'd be
get that. It's a good chance to do another, I'll send it along
Thank
to all
you.
3 of you. So we'll send both that and the CHOP, the
Okay.
community health assessment. Real quick on space, we've been well supported by Ken's teams, Shane and Joe with Kirby. We're 99% done. We're in. People are happy for the most part. Thank you, Ken. Christian for work on lease arrangements. Evans, the main remodel on the our adult behavioral health entry and lobby, which, as you can imagine, is our busiest reception area, and we're relocating and having a whole alternate setup to do that remodel work that Joe's the project manager, also going smoothly, very close to completion, end of the month, really, I'll just say July as a completion date for that one. So we're well on our way. And then we've had yet another delay with Lutheran coming in across the street, but all reports as of this weekend, an email I received from Jordan, he had talked to the owner of the building, and they were on track to move. So we would start our remodel at the Davis Street project on July 9th. And that's the new start date for Integrity for Bruce, who's got the contract over there. So that's moving ahead. It's delayed. We are definitely scrambling with space issues, and people are being flexible and creative, and we appreciate that. It's not ideal, but those are the good updates. And I could go to the warning unless there are questions. Warning is in June, contracts that are turning for July 1st are headed your way. It's going to be a busy month. We have budget adoption, a few changes. I'll be back if Laura needs to help talk through, nothing major. And then a host of PAs, and the PAs don't come here, but also the contracts for our contract employees and independent contractors for our licensed medical providers. And I am working on a 2% COLA for them this year, so a market adjustment essentially that is linked to the ongoing cost increase within healthcare. And those are all things that hit Christian's desk, mostly for review and approval before they come. So thank you, Christian, and to the board as well. I'll be seeing you a lot in June. That's the warning.
Thank you. Do we want to move on to, before you leave?
Yeah.
I want to move on to the preliminary consent agenda. I know there was some talk, the Nurse Family Partnership, the statistics around that are pretty glowing in terms of the success of that that partnership. So maybe before we, just a quick just a brief comment about that program for the commissioners to hear.
I defer to the most passionate person in the room about
Sure.
this program.
I've been wanting this program since I started here in Yamhill County 11 years ago. So it's really exciting to see it actually moving forward. It's a home-based program where moms who are pregnant with their first baby and have some sort of risk factor, oftentimes it's poverty or other types of things, they put them at risk of having a poor birth outcome, paired with a nurse who does home visits throughout their pregnancy and then the first 2 years of life after the baby's here. And even though the program ends when the baby's 2, we see outcomes that go well into adolescence with reduced rates of alcohol use, reduced rates of being in the juvenile justice system. Moms' rates of postpartum depression and just depression overall are significantly reduced. So lots of great outcomes, and we have a team of nurses over at Public Health who are really enthusiastic and excited to be in this work.
Okay.
In the agreements, there's actually 2 agreements within this action item. One is with the Oregon Health Authority for our Nurse Family Partnership Program Award, and the other is with the actual company that does the implementation for the evidence-based model, which is, I believe, they're out of Colorado.
Yes.
But they're both with the Oregon Health.
No, one's with the Health Authority, one's with the company out of, they call it Nurse Family Partnership.
So, okay, so that's item 2 and 3. We'll get to item 1 in a second, but I just wanted to move on. On item 4, is there any questions about that? With OHA for the Medicaid administrative claiming, that's just,
I don't see any dollars attached, so it's. just an
The
agreement
action may
that-
not have been written with financial figures attached to it on the agenda item, but there's a maximum amount payable under the cumulative 5-year period of $935,000. We don't expect to draw down those funds. This really is tied to the detailed work of looking at a time study of all the staff that are in this pool of workforce. And what we expect this year in 17-18 is $110,000. Next year we have budgeted $130,000. So that not to exceed that's close to $1 million is not probably that accurate in terms of the total figure, but that's how the state writes the contracts. They tend to give you a much higher not to exceed.
and item 5, which is the amendment number 6 to the agreement between Yamhill County and Oregon Health Authority. And that's that previous board order, and that's that additional almost $16,000.
Yeah, for the prescription drug overdose prevention program.
And that's Jill's.
Jill Dale is our coordinator, and this is a regional grant award from Marion Polk Yamhill. It's a harm reduction model. We're working with physicians, medical community on opioid and other prescription drug use and abuse, and how to really use evidence-based strategic models that will reduce our harm and hopefully prevent injury, death related to that epidemic. So we do a regional award, but this one happens to be the way the federal money comes to the state is in an April to April. And so they will only give us through April, and then they adjust it and give us May and June, and that's what this is. And then it's anyhow, it's a contracting issue more than it is a change in scope. We've already accepted and are doing the work.
So if there are no other questions for Lindsay and Silas on these, we can move ahead and let them get back to work.
The only thing, again, out of that conference was the higher incidence of opioid with the seniors. And that it's a growing concern, so this is something that I've got a lot of pictures that I got back. But who was the young lady that was there in Pendleton from your office?
Was it Jill?
Jill Dale.
I'll have to make sure I've got her card. We set it for table several times, but I can look at faces, but I don't.
Well, we have 600 employees.
Yeah.
Sometimes we struggle with our
She
300
was
plus, so-
one of the ones that was on the suicide team.
Oh, okay.
I get her
Yeah.
card.
Well, yeah, please do share the resource.
Yeah.
She was very, very good at work tables because we broke into different work groups.
Oh, good.
Anyway, so
It's nice to hear.
Thank you.
Yeah.
Thank you for being here.
Thanks for putting up with all 5 plus the warning. We
Appreciate
appreciate that.
The warnings are important.
Thank you.
Yes.
All right, we'll move on to item 6, which is the approval of amendment number 2 to the agreement granted to the Manville County and the State of Oregon Office of Emergency Management. Thanks, Lindsay, thanks, Silas. And for the Emergency Management Performance Grant to reallocate used funding to, in other words, basically what Brian is saying is that they were not going to utilize all of the funds, so they're going to take this 9,000 plus and apply that to personnel. So we don't have to, return money, we can use it to cover personnel costs. And the other one was the under preliminary consent agenda was approval of the minutes for April 5th, April 12th, and for formal, and April 19th for the formal session. And on to item D, which is non-consent, the consideration of the submission, item 1, of the Regional Infrastructure Fund application on behalf of Willamette Valley Vineyards. I think we've all had a chance to meet with Bill Cross. Do we have any questions for town council or for our administrator or?
And we left the most recent version of the grant application with you at your places because we did have some changes over the weekend.
Just for clarification, I will be meeting with Bill tomorrow afternoon, but I've talked to him enough, it's changing enough details
To understand.
conversations to understand.
So I just had a couple of questions relating to this in terms of the counties. So I understand the whole purpose of the appeal letter was because they were not a local government entity, and we would submit this application. A couple of the things that Carrie had requested were concerns that I know a couple of us had as to the, in other words, how are we justifying some of the statistics and some of the figures that were in here, and how those were supported.
Because we didn't prepare the original application, we don't know what methodology they used to provide the figures in their grant application.
Part of my concern in this, and I think it's a great deal, and part of my concern is this, it seemed to me when I looked at the original application that language and now the extension, because it seemed like we're getting involved awful late in this process, and I haven't talked to anybody like James LeVar to understand how this whole thing came about. And now over basically the last week and a half or 2 weeks, are we just, since it is a RIF account and it does have to be through the government agency, why we're getting involved? I mean, why weren't we involved a month or 2 months ago? And I'm concerned with making sure that if we do this, that we look at how this all occurred, make sure that it doesn't happen in the future, and certainly don't want to set a preference of one against the other. So I'm a little bit concerned not about this application and not about us approving this application, concerned about the whole process that it went through, and why now are we just getting involved in this
I
now?
spoke to James yesterday. They had no knowledge of the application prior to receiving it. So they received it and then recognized that it was not eligible because it hadn't been submitted by a local government. And so they wrote a letter saying, I'm sorry, this will be declined as a result. And then they contacted the person who wrote the letter, and then through those conversations, James and the rest of that group thought it was a worthwhile application if Yamhill County were willing to take it on as being the fiscal sponsor.
Well, maybe that's a question I'll have for Bill. How did this whole thing, since it's an online application, they had to get online and do it.
They didn't read it.
Yeah, but how did it even, who said, there's an online application? How did this whole thing get
Well, I think that
started?
James LeVar, there was some conversation with James LeVar, and and I didn't understand that disconnect as to how it got that far without that piece about the local government entity being central to the whole application.
Yeah.
But the other thing that I was concerned about was, it looks like a really good project, but I'm concerned, number one, about us putting our imprimatur on this without any, really any substantiation of the figures for salaries, salary ranges, things like that. It seemed like there was quite a range, and I don't know if it's arbitrary or not. The other thing is I want to make sure that the county is not you know, we've seen this before when the county signs on as an agent to help somebody get further along in the process of a project, and now we could become, you know, not to bring up a sore subject, but the trail, we signed on to be sort of the agent in that, and now we're very deep into it in terms of staff time and finances and liability and all that. So I don't know what our financial liability is going forward on this. Commissioner, did you know? Or did
The only thing that I understood from Bill Cross is that they are absolutely guaranteeing that Yadkin County will not have any financial obligation in this, that they will absolutely shield if there's any additional funding, anything necessary, that Willamette Valley Vineyards would step up. And part of that was from the money they raised from the sale of those stocks. But he said that they would.
Do we have that? Is that?
I do not,
Is that-
it's not in writing
Because
anyplace.
if it's not in writing, it's not.
It's-
It's like a handshake, it's
Not
not, that's right.
Yeah.
Yeah,
Essentially.
and I, according to my conversation with Bill, I don't think there would be a problem getting some kind of documentation to that nature if it was something that we.
I mean, what is our level of
So-
financial commitment?
Well, I'm asking
At all.
if there was.
So our commitment is for the 300,000. So if we are to do this, the proposal is asking for $300,000 in regional infrastructure money. And as the fiscal sponsor, that is the part we would be guaranteeing. So you would be guaranteeing the outcomes that they are specifying to the end of that $300,000. So
Up to, because that's the.
yes, so that's the amount that you'd be looking at, is they're asking for $300,000 for these guaranteed outcomes, and you are going to have to guarantee that as well.
If
So
for
that-
some reason they did not achieve the
Right.
outcomes.
So, okay, because now they also, they talk about the range and that they would accept 150,000 of a lesser reward. But my question is where are we, I guess, indemnified for having to either make good on a project that doesn't quite.
You're not.
I don't think we are at the moment, not in this application.
I don't know that you can be. I mean, that
Well,
obviously is your
We'd
question.
have to strike a different agreement with the beneficiary of the money,
Yeah.
right? Whoever this money's going to, Willamette Valley Vineyards.
Your memo of understanding or whatever would be, I guess you could,
Yeah.
So what is the
Then we can
contract?
ask them for some form of a guarantee.
right.
Yeah,
Yeah, and I
a
think-
bond of some kind, a performance bond.
What does that look like?
We've done it on a number of occasions. I mean, I don't know if it would be a bond, if we can actually buy a bond for something like this. It would be, you know, we just did one with some of the applicants for the solar farms, right, to make sure we had
Right.
decommissioning money. They deposited the entire amount into an account that we have access to in certain circumstances. We could ask these folks to do the same thing, make sure we had that money there in an account that was protected and accessible in the event they didn't follow through. Or you could probably buy some form of insurance policy, which is essentially what a bond would be. And there's a number of different ways. It depends on your concern, you know, right? You know, how risky do we think this is? How likely is it that they don't follow through? You know, how concerned are we? We can ask them for the full amount, or we can ask them for a
Carrie,
percentage.
do you know if this is upfront money or reimbursement?
It's reimbursable.
So that lessens your risk,
Yeah.
because they wouldn't reimburse
They
until
have
the
to do the
project is
job, then they
completed.
get reimbursed, so.
Because I know they raised, didn't they're guaranteeing another $10 million.
Yeah, so I'm
That
not
lessens my
concerned.
concern about.
Yeah, I'm not
the
concerned about
liability.
that
Reimbursable now, so they do the work and then they apply for,
Just like
They
we
get
did.
they get reimbursed
Yeah.
from
We
Business
would
Oregon.
do the application and we would request reimbursement for those spent dollars within the project timeframe. And we would have to stipulate whatever was
Yeah,
met,
that's-
whatever conditions.
We wouldn't.
And we're not on the
ask
hook
for
because they've already
reimbursement.
paid for it.
Yeah.
Okay,
So
There's that.
that's fine.
Right.
And
So-
if they don't do the work and the money's never drawn down, then they're
And it's not,
repaid.
it's a.
Yeah,
that's
that's,
there, it's on
that's your
there.
guarantee.
Yeah.
Okay,
They only get what they've already justified.
Yes.
And we would be the gatekeeper for submitting any requests for reimbursement.
Yes.
So we'd be able to confirm that the work had been done and there was justifiable
They have
reimbursement
They have to
request.
bring the completed documentation, we send it to the state reimburses.
So then we can, we're gonna agree to put this on the consent agenda?
I'm fine with that.
And you've got a meeting with Bill tomorrow,
Tomorrow.
so that'll answer
If you have
your
any
questions.
further questions, then you can bring them up.
Yeah.
The next-
Well, that answered one of my questions, but I do have questions on, for us from the county, not for this particular one, but this answered a lot about how we do set a preference or not set a preference. It sounds like we really already almost have one in place if we get these other applications, such as there's somebody comes through and wants to do another one of these, and they say, well, it's gonna cost us $5 million. We want you to back it for, or be the guarantor for $100,000, that I wanna make sure that we're not putting ourselves in a situation as other people come forward, that we can handle those on a one-on-one, and this doesn't
Case
somehow
by case
come back.
basis,
Yeah,
yeah.
it doesn't come back.
Exactly, setting a precedent.
Is this a
Okay.
new program, or is this just the first time we?
No.
It's just the
have
first
it?
time.
First time a regional solutions project has been applied.
And there are other
Two others.
applicants within the county.
And they're related to infrastructure,
Mhm.
so.
Okay.
Okay, so we good to move on to item 2, item D2, which is consideration of that ad and made in the Yamhill Valley 2018 publication, Commissioner Krivich?
Yes, I talked to Terry, just to get some space. We haven't come up with any kind of a commitment yet. But I'm working with Abisha. I want to advertise the fact that we are in business, that we are aggressively seeking new businesses for Yamhill County. And I want to have SEDCOR participate in the development of an ad for that publication. We've taken an ad in that publication every year, but I want to really attach it to what we're doing with SEDCOR and our renewed vitality in economic development. And so I want to develop an ad with the resources that SEDCOR has in creating ad and copy to put into this publication. It's a year-round publication. I mean, it's a once-a-year publication that gets distributed, so.
What's the distribution of that?
Can you help me with that?
I'm sorry, I can't.
Yeah.
Oh, when
No,
it's
my
cold.
equipment.
It's fairly substantial. if
It's not
I'm
my
not
job, that's
mistaken.
another department.
It is fairly substantial.
Yeah.
So, but is it, yeah, because I was wondering if we're just preaching to the choir and, you know.
I don't
Here,
think
no,
so.
that came up last time.
It goes to a number of.
Outside of the county.
In all honesty, I can't tell you exactly.
Yeah, I know
where,
we talked about this at one point, I
But,
can't remember what
but
the
I do
answer
know
was.
it gets distributed outside of the area. And anyway, so I had talked to Terry, I wanted to bring it to the board for, and get tentative approval so we can move forward building an ad. The max cost would be $719, and that would be to have the same thing we had last year's. with
Same
the
size.
Full page and then a 3/4 page on the.
Oh,
Board
an
of
article.
Commissioners.
Yeah, well, I can say that, after especially, I'm not opposed to selling, I can say after reading this month's issue of SEDCOR's Enterprise magazine,
Yeah.
I've been very impressed, and have seen since she's been here with what Abishai's doing, and also the write-up in this month's about Ferrum Technologies, and
Right.
and that, I don't know how many thousands of Enterprise magazines they send out, but I think I just feel kind of like we're starting to see a little benefit now of using SEDCOR and what they're going to do in Yamhill County, so I'm not opposed to
They
this
have
whatsoever.
a long reach.
Yeah.
But anyway,
Do we have, and where is that coming out of this, the economic
Economic
development money?
development,
yeah,
So that'll come
the
out of that.
$719.
So everyone's good for that to be on the consent agenda pending.
Do we have to put an amount in there, like not to exceed $1,000 or
719 is it?
Or 718?
But
I like a little,
well, to have exactly what we had last year, which was a full page and then
Color.
another 3/4 page, was $719.
and that was colored, the art, black and white,
Yeah.
had colors, and, yeah, well, and 1719, it could, we don't know, it's gone up a little bit this year.
That's the number she gave me
Oh, okay,
just
well
2
then-
days ago,
okay,
that would
that's
be it. We can put up to 1,000 if we want to do some alterations to it, but.
I would rather do that, because there's not a lot of difference put up to 1,000, but based on the 719.
Not to exceed.
Not to exceed $1,000.
Everyone okay with that?
Yes,
Yeah.
sounds good. I know Commissioner Prozich is on a time crunch, so I wanted to
Oh,
bring
no,
up a
he's
couple of
got
things. So I'd like to go through this kind of quickly if we can. I wanted to bring up a couple of issues that we could discuss, and I know that there's been a lot of travel this summer, this spring rather, where we've had some challenges getting county business done because we've had two commissioners at the same conference and two commissioners, or lots of commissioners being gone while we're trying to get some basic stuff handled. So,
First off, what have we not gotten done that we should have gotten done?
well, we've had some challenges trying to schedule meetings that needed to be done. Laura can address some of the constraints we had with meetings that had to be done within a certain amount of time that we weren't able to get done. We were able to get done, but it was kind of was constricted. And so I wanted to just bring that up and also say that from my, just sitting back and my observation is that I don't know that it's necessary for us to have two commissioners go to the same conference. So that would be one thing that I would recommend, that we have one commissioner designated to go to the conference based on whether it's your area of liaison or area of your special interest, but that we're not only spending the personal capital of having somebody outside of getting work done in the county, but we're not spending funds to do that. So that's one issue. And just wanted to bring that up and see how everybody feels about that.
Well, I guess my opinion on that one, Madam Chair, is that some of these conferences, there's so many concurrent sessions that go on that they have at the same time for multiple areas of liaison and just general overall county issues. I have a little bit different approach to it. I don't necessarily see any, two commissioners, even three commissioners going to the same conference, as long as we're not all sitting in the same sessions all the time, getting the same information, because there's enough sessions that are going on. I think we should be able to look at a conference ahead of time and saying, okay, here's some work sessions I'm going to attend, here's some work sessions you'll attend, here's some work sessions maybe you'll attend. So we're, other than the general session, we're not all sitting in one. But the more I look at this, and I have a different approach to it, is I think the changes we implemented last year for the work sessions have been very, very good. I think, to me, the biggest waste of time is, and I understand the work sessions and everything, but the biggest waste of time is if I look, we accomplish a lot more here, I believe, at the work sessions than we do at our formal meetings. And a lot of our formal meetings, most of the year, I'm not talking about last one, most of the year maybe last 10 minutes, 15 minutes. If it was, and this is just my opinion, if it was me, I might not have the work sessions as often, and then take whatever we do at a work session and combine it as part, and make an hour and a half Thursday meetings, make our formal meeting, expand our formal meeting out a little bit to address it. But that's just the way I would probably address it.
So, yeah, and that will probably dovetail into it. So,
But getting back to what you were saying, I think a conference like the one, the WIR, for instance, Western United Region, there are so many things that are integral to all of the work we do throughout the county, because they are, again, the multiple workshops that give us opportunities to learn what is happening in the other western states. I mean, we can sit here and belly button stir all we want, and that's exactly what we're going to do. If we find out, I took a couple of those mobile workshops over there that were just really, in fact, I've already had 4 meetings about the things that I picked up that I think can really be good for Yamhill County. Not replicating, but I go back to my 24 years on the school board in Minville. In that 24 years, I went to 19 National School Board Association conferences. We have 17 pathways over at that high school. At least 13 of them are the result of things that I went to workshops at those national conferences and came back, sat down with our curriculums director and said, I know we have this going on, how can we incorporate some of these things? And so they're tremendous learning experiences now. specific, like tomorrow, I'll be at economic development. That's specific to development of an economic strategy down in Corvallis. And we don't need more than one commissioner. That's the area liaison. So, but these larger conferences for more than one commissioner to be at, if we're gonna truly do the county's work, we need to know, we need to be educating and engaging ourselves in that work.
So
Go ahead.
I just want to say, for us to do the county's work, we need to be in the county. And there have been a lot of trips to Washington DC, there have been a lot of trips to parts around the state, and I feel like you can always find a conference to go to, and you can always find something that you're going to glean from it. But if we're not here doing the work, it's not only expensive, it takes us away from our county. And I would say that, yeah, you could really stretch and say we've gotten information, but I'm just looking at it, having watched this over the past couple of months, and I do have concerns about the number of conferences, the amount of time gone from the county, and what it's costing, and really what do we net. So that, I'm just asking what we want to see as far as a policy going forward. And I'd like to, if there's no time to discuss it now, I'd also like to talk about our travel policy and lining that up with what the rest of the county employees are required to do, because that's not what the commissioners are doing. And I'd like to make sure that we have an equitable travel and expense policy, that the commissioners are not above that. The commissioners will comply with what the rest of the county employees are doing. So if we don't have time to talk about it, I don't want to give it short shrift, but I think we should adhere to the same policy that the county employees do. And that perhaps is a discussion for
I think that's a separate, because that can be a long, big discussion.
Maybe we can talk about it, because I know, Commissioner, you have to go. But I'd like to look at the dollars involved. I'd like to look at mileage. I'd like to look at commissioners being gone multiple times during the month, and what our policies are going to be going forward. So maybe we can think about this and then come back and talk about it at another work session.
I have one thing, John, I don't, Commissioner Pernisich, that I have to agree with him. You know, everybody's, all three of us learn different ways. We find out different things in different ways. Whereas Commissioner Pernisich may get a lot of, on these sitting in on the formal sessions, and I do too at these conferences and learn stuff. But probably 70% of what I learn is talking to people offline, see what they're doing in their county. What can we bring back to Yandell County? What's Yandell County can do that we bring to them? And so I think this whole thing about is an educational training. To me, it's not about attending a conference. It's an educational training about learning things we can do best for Yandell County. Now, I agree with you, Mary, that there's my problem has always been that we bring all this back. But because of the way we do our meetings, a lot of times we don't share all this information while we're bringing it back. And I think if we can improve the sharing, because I've learned things on mental health that I've talked to Silas or Lindsay about, but you and I haven't really talked about them, because unless we talk about them in a work group, in case it comes in front of us, we really can't, because we'd be a violation of public meeting laws. And so I think that's the issue to me, it's how we share information.
Yeah, and I think the important part is not so much sharing with each other, sharing it with those department heads that are actually going to do the work. This is what they're doing in such county and someplace else. And I know we have programs, some of this, how can we incorporate this? Because this is the outcomes they're getting. And that's what you're doing. You're really, anyway.
I know what might be good,
Yeah.
I know what might be good is to come back with a list of all of the things that on these conferences you were able to implement or share here in the county.
Yeah.
And so we can see, is this, let's go back to that evidence-based term. Is anything of all the conferences over the last 4 years that have been attended by commissioners, I don't particularly choose to go to them because I think there's enough work here in the county, and I think a lot of the times, it's stuff you can read online. But I would love to know how we justify the cost and the time, and maybe if you can make that argument, it would be a moot point, but just something for us to talk about.
I agree. I agree. One thing that I would like to see in the future on the same issue is, and we always have been in the private sector. We did it, and I don't know if you did at the school board stand. We always did it at the city, all of our counselors. as part of the budget process, we identified, okay, we're gonna go to these 4 or 5 conferences. This is what estimated airfare, this is what estimated expense we're gonna be, this is the cost of the contract. And then that was your travel expense budget per commissioner. Now, sure, there would be a few things that may come up, there may be something you don't go to. But that way, going into the year, you have a better idea of what people are gonna attend, what they're gonna do, what they're gonna spend their money for. And I was really kind of taken back when I came to kind of because I think I might even said to Laura once way back when, it's like, how do we do our travel budget? How do we know what, I want to attend this conference or that conference, I know it's gonna cost this much and this is where it's gonna be at? Because usually you know that the year, before the beginning of the fiscal year. And to find out, well, we really don't, so we put so much into our commissioner's budget. And that's used, but I agree that there really isn't a lot of accountability for what we spend
No, I don't think there is.
money on. And I agree with that. So maybe that's one of the kind of changes we need to look.
Do it during compensation committee where they talk about,
Yeah.
commissioners will get this, anyway, just
But
something.
anyway, I
about-
think I appreciate you bringing up that
Thank
fact, because
you.
I think it is a good point. So it goes back to accountability.
Absolutely. All right, well, we have nothing else, and I know, Commissioner, you have to get on the
Oh,
road.
one
You
thing,
have one more thing.
I'm sorry. So we're, on the 14th, we're gonna have a transit district board of directors meeting. And we have quite a number of issues to cover. So if the board is in agreement, on the 12th, we'd like to use that work session time to schedule a number of topics for your discussion. We would do it anyway during that informal work session time, but I'd like to get consensus that I can use the work session time at the beginning of informal to schedule a number of transit
Are we
items.
scheduled for 1 o'clock that day or 1:30?
And that's on, what day is that?
That is on the, well, no, the informal is on the 12th.
12, not 12, okay.
So for your informal discussion about the transit items, on the 12th, I'd like to use that work session time at the beginning of the meeting.
At 1:30?
And I think,
I'd like to move it up, because I don't want to, transit's a big thing. I don't want to get to the point where we're trying to cram everything down.
we can move it to 1 if that
On the
works.
12th, I have a meeting with the head of DHS.
Okay,
And
so,
Well, then
but you'll
whatever day you
also,
want,
on
yeah.
Thursday, for your board of directors, we also have an hour set aside. So
Okay.
we could continue the discussion if
Okay.
needed for that entire hour.
Okay, that
So if
sounds-
everyone's okay
I'm
with
not
that?
what
I'm not
time?
opposed to that, Debbie.
Okay,
I'm sorry, can you just repeat that? I'm
so the 12th is the informal
And then on
discussion.
the 14th.
on our scheduling.
Yeah, so your normal informal work session time. And so
Right.
I'll use the beginning to have a work session on transit issues.
Got it?
And then on the 14th at 9 a.m. is your transit board of directors.
Correct.
So we'll have an hour to continue the discussion and take action
Got
on
it.
the items
Okay.
that we've already
That
discussed
sounds-
on Tuesday.
Perfect.
Sounds good.
Does that make
Okay.
sense?
All right,
Right.
thank you very much. All right, then, if there's nothing else for the good of the order,
Nope.
we'll adjourn today's informal
Good.
session so Commissioner Primovich can get
Tuesday.
to
Move
sail
smart.
without speeding.
Move smart.